If you run a medical practice, your front office is drowning. The staff isn't lazy, and the management isn't failing. The math is failing. The daily administrative workload in American medical practices has grown at a rate that standard staffing models simply cannot handle. This chart shows exactly where the time goes, according to the American Medical Association's 2024 Physician Time Use Survey. In a standard week, physicians are spending 13 hours on indirect patient care, and another 7.3 hours purely on administrative tasks. When you combine those categories, you see the reality of the modern workday. 49% of a physician's office day is spent on electronic health records and desk work. That is nearly 20 hours a week per physician that never touches a patient directly. The sheer volume of paperwork and data entry is bottlenecking the system. Administrative bloat is actively cannibalizing direct patient care capacity across the entire healthcare sector. The workload itself is only the first half of the problem. The secondary crisis is that the people you hire to manage these platforms keep walking out the door. Data from the Medical Group Management Association reveals that front office turnover across all medical practices hit 40% in 2022. And heading into 2026, medical assistants and front desk staff remain the most frequently cited turnover hotspots. An empty desk is the starting point of a financial cascade. Recruiting, onboarding, and training expenses combine to hit $9,000 to $12,000 per departure. Finding a replacement is equally brutal. When you add up a $35,000 base salary, payroll taxes, benefits, training, and the hidden cost of constant turnover, a single administrative seat actually costs a practice over $60,800 a year. Medical practices are trapped in an unsustainable financial loop. They are paying premium, escalating rates year over year for a workforce model that is highly unstable and deeply inefficient. At the center of this administrative crisis sits Kareo. Managing this specific electronic health record platform requires complex, multi-step execution with severe compliance implications for every task. When you force a general front desk employee to manage Kareo alongside phone calls and walk-ins, you trigger a staffing spiral. One generalist leaves, the institutional knowledge vanishes, and the remaining team burns out trying to cover highly specialized tasks like prior authorizations. The operational fallout hits immediately. Patient calls pile up. Insurance verification is delayed. Claims go out with bad eligibility data, denials multiply, and your revenue cycle slows to a crawl. This diagram shows a clinic structurally divided according to recommendations from the American Medical Association and MGMA. The research dictates a strict separation of clinical tasks from administrative processing. To operate efficiently, practices must use dedicated specialists rather than generalists for heavy EHR work. The Kareo platform operates exactly as designed. The failure occurs because assigning complex EHR management to an overburdened generalist front office mathematically guarantees operational breakdown. A growing number of innovative practices are solving the Kareo bottleneck by moving the workload entirely off-site. They use Staffingly, a healthcare outsourcing firm based in New Jersey, to deploy dedicated offshore virtual medical assistants. These are not shared agents rotating across dozens of clients. Staffingly assigns dedicated specialists who learn your specific patient population and workflow protocols. They function as a remote, permanent extension of your existing team. This network schematic illustrates how Staffingly routes the workload. Using AI-powered predictive modeling, the system instantly matches each incoming Kareo task to the specific human specialist with the best accuracy track record for that exact task type. Machine learning constantly monitors the data flow. If a Kareo output contains an anomaly that could trigger a billing denial, the AI flags it before it leaves the system, diverting the error to a human supervisor who manages the complex edge cases. This synthesis of trained specialists and AI oversight brings the error rate below 1%, solving the human scaling problem that traditional models cannot. The financial audit of this model is stark. A dedicated Staffingly virtual medical assistant working 45 hours a week costs $21,600 annually. Benefits, training, backup coverage, and management overhead are entirely included. This side-by-side chart compares the financial math directly. On the left is the fully loaded in-house administrative cost. On the right is the Staffingly VMA model. That represents a 64% cost reduction on paper. In operational capital, that difference leaves $39,200 saved per full-time equivalent every single year. That is cash that stays inside the practice. Security is engineered into the foundation. Every Staffingly specialist operates under strictly audited compliance protocols, maintaining full HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST certifications. With overhead reduced by 60% and data secured to international standards, the shift to an AI-augmented model becomes a predictable, stable alternative to the traditional hiring cycle. The deployment timeline removes the final friction point. Practices move from their kickoff call to processing live Kareo work in just 48 to 72 hours. Over 800 healthcare providers across all 50 states currently utilize this system to reclaim their time and stabilize their front office. Given the massive reduction in overhead, the elimination of recruiting headaches, and a deployment cycle of under 3 days, the relevant question for practice owners is why they would wait any longer. Rebuild your administrative workflow today. Visit staffingly.com/demo or call 800-489-5877 to start your 30-day risk-free pilot.